Good afternoon, and welcome to The Appeal Live, a co-production of Now This and The Appeal. I'm Alana Sibin. Last year, Anchorage approved funding to create a new mobile crisis team, whose role would be to respond to people who are experiencing mental health crises. And the idea behind this would be to send the people who are the best equipped to deal with these sorts of crises to handle these situations. And we've seen time and time again that police officers, they might be suited to solve crime, but not suited to help somebody who is dealing with a mental health crisis. So instead, this team will include behavioral health clinicians, paramedics, case managers, whose job would be to stabilize the person who is managing a mental health crisis and to connect them with the resources that they need, whether that be acute medical care, referral to a shelter, or a follow-up with a counselor. And so by exploring these sorts of alternatives to policing, Anchorage is joining a number of cities that are looking to divert these calls away from police departments and instead into the hands of the people who are best equipped to handle them. And by doing that, they're freeing up police departments to do things like solve crimes, and then making sure that mental health crises are handled in a way that is efficient, effective, and compassionate. And so for more on Anchorage's new mobile crisis team, I'm so pleased today to be joined by Anchorage Assemblymember Meg Zaletel and Jason Lessard, Executive Director of the National Alliance on Mental Illness Anchorage. Thank you both so much for being here today. It's really a pleasure to have you.
Thanks for having us.
Absolutely. Thanks for having us on.
So Assemblymember, I'll start with you. Talk to us a little bit about, just give us a quick overview of the program and a status update on where it stands right now.
Sure. So the mobile crisis team is something we've funded through a new alcohol tax that is just being implemented in 2021. So we had a new funding stream, and we really had this conversation during COVID about the mental health challenges people were facing and the increase in calls, and that providers were having to adapt because they weren't able to do as many in-person appointments. And the state had been looking at a model called Crisis Now, which has a mobile crisis team portion to it. But that funding and the need during COVID really kickstarted our conversation about how we could implement this now or quickly. And we had a companion program through the fire department called our core team, which was specifically targeting high utilizers of emergency services that, didn't have access to regular care. And so this is really an offshoot of that. So we funded through the alcohol tax to the fire department to stand up this new team. And it will include a behavioral health clinician and a paramedic to start. And then as we get peer training on board and peer certification, we're really excited to bring that component on. So when someone encounters the mobile crisis team, there'll be someone who knows what that person is going through. So that's the general outline of the program. It'll be a 12-hour model to start, hopefully soon to be 24-hour. And we're about a month away from that team hitting the streets.
So I'm curious to hear about how that is different from the way we see Anchorage dealing with mental health right now. So Jason, could you talk to us a little bit about what the police first responses looked like and why that necessitated this change?
Sure. Well, in your intro, I believe you hit a lot of, the reasoning on the head is that we're looking to send the right team there. And a law enforcement officer is a law enforcement officer, and they view everything through the lens of the law and, a criminal aspect and things like that. And not all the time, but it's not necessarily their job. It's not the reason why they got into the job. And we, by default, as communities all across the U.S., have shifted this work onto our police, I think simply because they're available 24/7. They have some medical first aid training and some de-escalation techniques that they have under their belt. But it's clearly not enough. And, I'm proud to say in Anchorage for a long time now, we've been utilizing the CIT model, Crisis Intervention Team, which is run through the police department. It started in Memphis with NAMIs years ago. basically to train these specialized units on how to best handle a situation with a behavioral health crisis. And they do great work, but there's not enough of it. And they are still on the job as police officers. So no matter what their skill set may be, the minute you show up to a scene, a crisis scene, or somebody's in psychosis, and you've got a cruiser and a badge and a holster with a gun in it and everything, it doesn't matter how good that person is at their job. That situation is already heightened. And when somebody is in crisis, optics can mean so much. And so that simple fact alone, by responding with a different team, just based on optics, is going to make a major change. But there again, you've got these folks that this is what they've been trained to do, as opposed to police, where this is one of the things which we've put sort of, on their list of duties. And so, we've been trying to progressively make a positive change in the way that we respond to these crises in Anchorage. And this is just one more step into what I see as a better response, and ultimately fitting into the Crisis Now model, which Assemblymember Zaletel had mentioned moments ago.
That's a really good point that you make there, that even if you have the best police officer, the best team possible, simply the sirens, the presence of police in itself can be triggering for somebody who's dealing with a mental illness. And so we've also seen, reports from cities across the country that have suggested that, police don't need to be the ones who handle these sorts of crises, and that there's somewhere between 20 and 70% of all calls for service that currently go to armed police officers when they don't need to. So I'm curious to hear, and I'll start with you, Assemblymember, on this one. If you have a sense of where Anchorage falls on this, as in how many of these calls do you think don't need to be given to police? And if with a fully scaled up mobile crisis team, you think they could handle more, and how much?
Yeah, it's a great question. And it's actually something our police department have been tracking. They've actually been involved in the development of Crisis Now for this state and in Anchorage. So they estimate about 7,300 calls a year will be diverted from their call stream when we are up running 24/7. So that's a significant number of calls. It's a significant number of our significant amount of time for our officers. Something interesting about the Anchorage Police Department is it was undersized for many years, and has only recently come back to being kind of right-sized, on the small size of right-sized, but right-sized. And another interesting thing is that Anchorage is a huge geographical area. And so we have about 90 officers on per shift, but they cover kind of the space of a small state. And so they are stretched thin already. So being able to take this off their plate and do a more suited and better response is a win-win. 7,300 calls may not sound like a lot, but shift over shift, and that's 7,300 encounters where there's the opportunity for something to possibly go wrong. And so utilizing the Crisis Now model, we're in like the second step of it. The first step, which we kind of jumped over because the state's working on it as a whole, is a call center. And if we can get the call center up and running, which we're really optimistic about doing, we actually can pull about 90% of the calls away from even needing dispatched personnel, trained individuals, triage, stabilize, make referrals just on the phone. Then that 10%, the crisis team goes out. And then from there, it's only a very small percentage, I think 2 to 3%, that actually need transport to further acute care. So it is really, one piece in a large diversionary, opportunity to not even have to have that, really abrupt interaction that I think interacting with police is very traumatic in and of itself, even if they're there to help. People aren't used to, the police in the same way. So we can take 7,300 calls and over time reduce it to where really the time that we actually have to send the mobile crisis team out is even further reduced. I think we can make really positive impact. Anchorage has done this with folks who experience substance misuse. If someone is incapacitated due to drugs or alcohol on the street, we actually have a mobile response team who go and check on them and see if they need further help, because it keeps the situation de-escalated, and it's the more appropriate response. So we've seen some success with this model, and it also took those calls away from the police. Mm-hmm. So we're just kind of replicating something we already know works from around the country and here locally. I suspect we'll start to see numbers go up, though, once the crisis team is rolling, because people will get comfortable with the idea that it's not going to be a police officer that responds.
And just a quick follow-up to that, you said about 7,300 calls could be addressed by this sort of team. How many calls are they staffed, or will they be staffed or equipped to handle right now, approximately?
It's a 12-hour model. So I think we're going to see in the first couple of months kind of how the data comes out. But if we just half it, because it's half the day, but it is one of our goals and our aims to be up 24/7, hopefully by year's end. So it's still a significant number of calls, thousands of calls that the police won't need to respond to.
Got it. So Jason, I want to get you in here. Talk to us about how you think sort of this type of model needs to be scaled up and how we get there.
Well, I think, Meg and I early on had discussions about that and what it would look like. I think we were both operating from the standpoint that we would like this team to look as much like the Cahoots model as possible, based out of Eugene, Oregon, which is really a community team. There's no like uniform necessarily outside of maybe their Cahoots t-shirts, and any degree that we could get from a police response in a cruiser in a uniform to this team, the closer we could get to that Cahoots team, the better. And also taking into consideration what our current infrastructure was and how could we best leverage that infrastructure to make this work and happen now. Because again, we have the Crisis Now model, which is onboarding potentially in the future, but this can have positive effects right now. And so, of course, we'd love to see it 24/7 as soon as possible, but I can tell you that we will start to see benefits from this right away. Most importantly is better outcomes for the individuals in crisis, but we will see savings. We will see, savings of time at the ER. We will see people that shouldn't be going to jail or to the hospital being diverted to the proper facilities for their care. We'll see costs in police going down. So it's kind of got, it checks off the boxes for all different kinds of people. The budget people, we see a cost savings. People in my line of work, we're seeing better outcomes. And so I can tell you anecdotally, I was on the phone with an individual just last week who was in some pretty severe crisis. And we had been on the phone for about 45 minutes and the police showed up. Another individual called for them a crisis check, a welfare check. And, he saw the cruisers pull up and he immediately heightened. And, it was everything I could do to keep him calm on the phone while trying to help him interact with the police. But he was out in his yard shouting. And had a different team responded that didn't show up, and he's like, "There's 2 police cars outside of my house. Did you call these people on me?" And his mood shifted dramatically. And again, no fault of these police officers. They're doing their job, and then they might have the tools to help him. But it was just that immediate response, and he went heightened dramatically. And so I think we'll start to see changes. And again, it's somewhat anecdotally now. Hopefully, we'll start to carry some data with this as we move forward. But we will see these kinds of changes where somebody might have been able to talk to that person, not me, a disjointed voice on the phone, but an individual right there with that skill set and with all the knowledge base and the referrals that they can hand off to this person and get them the help they need right then.
And Jason, right there, you talked a little bit about some other emergency first responder models that are being used in other cities like Cahoots. But I'm curious if there's anything unique about the needs in Anchorage that need to be accounted for in this model.
I would say, our status is one of the northernmost cities in the U.S. I mean, we've got, thinking of ways to get these people to a warm and comfortable place as quickly as possible. As you know, when it's 10 below and you're out on the street trying to diffuse a situation, it doesn't help that it's freezing out, and who knows what kind of condition these people are in if they have the proper clothing on to be there. So it's kind of looking at it as we need to defuse the crisis, but we also need to recognize where on the Maslow's pyramid we also need to provide help, and some of these people need food and shelter right away. So maybe there's a way to just get them to a warm place and comfortable to then continue with this work of de-escalating and finding the help that they need.
Yeah, I want to add really quickly that one of the reasons this model works in our fire department right now is we do have an unmet need. When we say behavioral health, we also talk about substance misuse. And so having a paramedic on the site can kind of evaluate for someone's, physical needs as well. Is this, truly something related to psychosis, or is someone under the influence of a substance? So I think that's a nice layer. Or if they've been, exposed to the elements for a long period of time, if they're experiencing homelessness, is there a physical need we can meet right away that might help diffuse the situation? Do they, need wound care? I mean, we're having an interaction with someone. So as comprehensive as we can be to meet the needs of those that we're going to interact with is really kind of at the core of this model. And I'm glad Jason brought up our weather, because, even if someone is in their home and experiencing a crisis, it might be best that they go outside. It is cold, and being cold and uncomfortable isn't going to do anything to help stabilize the situation. So I've had the opportunity to talk with our fire chief about this. What can we do? We're looking at a van model. Can the back of the van, maybe have a recliner in it and blankets, and just really be a comfortable, confidential space that someone could meet with someone in, that meets the needs of both the clinician and the individual. And so we're really talking about, as much as we can make a mobile clinic on wheels in some way, and so I'm really excited to see what they can come up with for the design, because I think it's going to be a key component to maximizing the utility of the service.
And I'm also wondering, I mean, not just about Anchorage, but other areas of Alaska. I can imagine that this model would potentially look different if it were to expand to, say, Fairbanks or any other sorts of areas. I'm wondering if there are any specific challenges when it comes to service calls in other areas, whether they're remote or rural, or if you think that this is a model that is specifically good for cities.
Well, that's a really big question for Alaska. Partly, not all cities in Alaska have police service, and not all cities in Alaska have roads. So there's some unique challenges there. And then like in Fairbanks, they are looking at the Crisis Now model, but they're, a fairly large city on the road system. But if you get out to even just north of us, a large portion of the police response is the state troopers. So I think it's just different systems in play. But the three core models, so the statewide crisis call center is really going to be a universal help throughout the state, that we can start there. That intermediate step is going to be a little bit harder. And then we know that if someone needs acute care in a hospital situation, that those in rural communities have great challenges, but we've really tapped into telemedicine during COVID-19, and we've been refining access to telemedicine so that you could still see a psychiatrist if you are in a rural village, or you're in Nome and the nearest psychiatrist, is in Anchorage.
Jason, feel free to add on to that, because I know you've looked at this as well.
Yeah, I was just going to add, Meg is absolutely right. There's a lot of communities in our state that just don't have the population to, really justify this kind of program. And so, that doesn't mean that we're going to stop there. There's still all sorts of training, so there's talks of bringing the CIT program to a statewide model. Getting more training for state troopers. We have VSPOs, which is a village safety patrol officer, which will go out to some of our smaller communities. And again, they might not live there full time. It's kind of a traveling thing, but making sure that they're getting the same training, the same de-escalation training, the mental health first aid, mental health first aid, both to apply it to others, as well as, there's a mental health first aid training for law enforcement and for first responders that also teaches them self-care. Because again, these folks are working on calls that are not necessarily where they got their training. And, there's a lot that an officer takes on emotionally as well. And so I think really looking at the whole system and how do we provide better outcomes for the individuals in crisis, how do we do it more efficiently, and how do we do it in a way that makes sense with the resources we have and taking care of those resources, right? The police are still going to need to go to a lot of these calls. There may be a behavioral health crisis where the mobile crisis needs backup because they can't do hands-on work. And if this person is in an immediate danger, if they're going to run out into traffic, we need somebody that can help and respond to that. And so this is not a full replacement for the CIT team. I think we should still have those kinds of things in our police forces. But I think the more we can get to directing the appropriate call to a response, the better. And they will just be there as great trained backup, hopefully a lot of times. And I think we're finding, when I've researched this with other states and other cities that have been doing this, it seems like the call for backup more often is coming from the police, or oftentimes is coming from the police asking the mobile team to come and help them out, rather than vice versa, where it's a behavioral health crisis and they realize they need law enforcement there. It's actually the opposite. And that's an amazing trend. It's proving what we're trying to do here, the need for it. And it's also showing that the police are recognizing this. We've had great support from Anchorage Police Department on this stuff. So yeah, I hope I answered that question.
Yes, you did. But I'm going to kick this next one to you, Assemblymember. So I know that there is an effort in Congress right now to create a new program at Health and Human Services that would provide somewhere between $500 million and $1 billion per year to support these types of programs that we're seeing even law enforcement is supportive of. And it would be in the same way that the DOJ and others fund traditional law enforcement now. So how important do you think this federal effort is for the ability of cities, counties, and states to expand these programs? And are you talking with members of Congress or other Alaska lawmakers about this effort?
So this is a really important effort, because if you track mental health funding at the state level, which is where it traditionally sits, it's often on the chopping block whenever there are budget needs. And we have just quite frankly, underfunded or defunded critical behavioral health services at the state level. And we did that in response to deinstitutionalization of individuals, which is totally the right move, but we didn't make the counter investment in community-based services. So to have federal support for it would be amazing. I am not talking with anyone at the moment, just because I have been fully in COVID-19 response lately, but we are having a statewide conversation about how we ensure mental health services and behavioral health services are adequately funded. This is one of the reasons Anchorage took the step on its own so that it could sustainably fund a resource without having to rely on state or federal partners. But knowing that there's federal dollars coming probably answers some of the funding questions we have about how to bring on crisis stabilization centers, how to look at the capacity of our psychiatric hospital, and then how to probably bring on a statewide call center. So there are some really exciting things about that. And I hope to work with our state partners, but Anchorage is really, has really suffered for a lack of consistent behavioral health services over the last decade. And so it's ready to make its own investments, not to exclude partnerships, but really wanting to make sure it's got some foundational services for its residents, because the effects of not having that are very visible and very costly to a municipality.
And I'd love to jump in here and just kind of tag off of something Meg had mentioned regarding the larger continuum of care in the state, and really, in the late 70s and 80s when deinstitutionalization happened again, it was supposed to be a big shift to this, and nationally we didn't see it, and even here in Alaska there's a lot of gaps in our continuum of care. It's a national problem. I'm not going to say it's unique to us, but I want to bring that up because this crisis team is not a magic bullet. This is one step, and this is one step that will provide better outcomes, but it can't stop there. The conversation can't stop there, because if we're meeting somebody and de-escalating a situation and stabilizing them and saying, okay, here's where you need to go for your next step for help for yourself. But those resources are swamped because there aren't enough of them and more people are needing them, then we're not fully doing our job. We need to go on to the next step and say, okay, how now do we get rid of this blockage in this system? How do we get better care in our local communities? Instead of sending somebody to a treatment bed in one of the larger hub communities, how can we keep them in their own community around their own people that can go see them? This is a super important work, and that's going to be the next step. I don't want to take a victory lap on the mobile crisis team and kind of, all right, we did a great job. This is one step in a much larger project, and I just wanted to kind of reiterate that.
There's certainly always more work to do. But thank you both for the work that you've been doing and for coming on our show. It's been a pleasure having you, and keep fighting the good fight.
Thank you. Thanks so much for having us.
Thank you so much. It was a pleasure.
So what was particularly interesting to me in this conversation was to hear about this universal understanding within Anchorage of the inefficiency of police being the main responders to crisis. They're not only not the ones who are the most well equipped. That was a mouthful. But they also can make situations worse, even if you have the best police department possible. And so for that reason, we're seeing that law enforcement is actually in support of having some of these calls being taken away from them. And so we can only think about and imagine what a better place Anchorage and other cities across the country would be if these sorts of programs were scaled up. I mean, we've heard that if this program was fully scaled up, they could be handling up to 7,300 calls and perhaps even more throughout the state. And this, just as Jason said, is sort of just one step. It's not the be all and end all of proving mental health services in the city, in the state. And it's something that cities can be looking towards and that Anchorage can be looking towards as a model for what to do in the future to properly address crisis in the area. So thank you so much for joining the Appeal Live. That is all the time we have for today. Keep following us on Facebook and Twitter to get the latest news. We'll see you next time.